Okay, hello everyone, good evening. Hopefully you can hear me, you can see me. I see that we have a few attendees joining in. So if you can just maybe write me in the chat that you can see me or can hear me, that's okay. And yes, perfect. So good evening everyone again. My name is Kateřina Kvasničková. I'm treatment coordinator at IVF CUBE in Prague. And firstly, I would like to welcome you at my IVF Answers by the European Fertility Society. And today we will look at one of, I would say, really important topics, which is the IVF pricing and especially IVF pricing traps and how to avoid the hidden fees. But firstly, please remember that this whole event is recorded, but also all the anonymous, and the recording will be available tomorrow at my IVF Answers platform and also on the YouTube channel. So if you miss a part of it, you can just watch it later there as well. So right now, as mentioned, I would like to start maybe about the presentation. From the beginning till the end, you can always write, if you have any questions, any inquiries, anything, you can just write it in the chat. Now we will have a short presentation afterwards, short Q&A session, and I will address all of your questions that will be in the chat in the meantime. So here, if we start, hopefully you can see my presentation. As I mentioned, that my topic is the IVF pricing traps and how to avoid hidden costs. And especially we want to talk about this topic to help you to discover how to spot extra charges, how to understand real IVF costs, and why our all-inclusive packages, what we offer at our clinic, can give you a complete peace of mind. So, yes. As mentioned, sometimes it's quite difficult there is a difficult orientation across different price lists, across different clinics, because you have to compare, I would say, uncomparable tables, because there is not always the same price list, there is not always the same table, and sometimes you might not know what exactly does it mean, because you not always know what you will need and how to orient in these price lists. And I want to help today to show you and maybe get better understanding and better expectation what the IVF costs, because it can be quite big part of the IVF journey. We know that some clinics also offer the packages, price packages, but we have to be careful, because not always they're including all necessary parts of the therapy, not all the methods. For example, quite crucial things like the fertilization of all eggs, cultivation of the embryos, but also even the anesthesia during the particle procedure, egg collection, or even the cryopreservation and the storage, processing and the sperm selection. And even if there are these costs included, the packages, these costs are stated just like from. So you, at the beginning, you don't know how you will end it up and what will be the final bill. Because it can happen that if you are not familiar with the IVF, if this is your first therapy, you don't really know what you will need and what has to be the part, what's crucial, what's optional, and what you can choose. So it's difficult to make your own calculation, let's say, especially if in some cases, if the final costs may rely on the, let's say, number of eggs of the outcome, a number of eggs, number of embryos, and you want to have as much embryos and as much eggs to get the best outcomes, and you don't want to calculate if I can afford it to have a good outcomes from the IVF. So sometimes it can get you into, let's say, uncomfortable situation. I would say maybe in the unethical position to decide if you can afford to have many eggs and how many eggs you would like to fertilize and free, especially biological background. If you are not fertility specialist and you just want to focus on your journey to get a child, to get a baby, to get pregnant. So we want you to feel comfortable and don't worry about this and put you in any uncomfortable situation, because the whole IVF process, whole IVF journey can be difficult on its own. And so at our clinic, we offer complete final price packages, or we can say all-inclusive packages. And as we want to be transparent with you, so there are no hidden fees, and this price, it's always the final price, so you don't need to worry about number of eggs, because all the therapies, all the prices are regardless to number of retrieved eggs, number of retrieved embryos, and finally the payment is due to the day of your fresh embryo transfer, so you don't need to worry about the payments, prepayments or deposits in advance as well. So I just feel really this important, even because as I like a IVF specialist, I know what I'm doing, I will know what I'm looking for. But even if I personally look at some price lists from different clinics, I'm like unsure what they actually mean, because if there is cost for 𝐾𝐶 therapy, 𝐾𝐶 method, and does it mean that you will fertilize all the eggs? That means then you will cultivate all of your embryos, or if it's just for one egg, or it's per, I don't know, 5 eggs, and then you need to pay some extras or something. So in that case, I see this really difficult to understand as just a patient, because as mentioned, you want to get as best outcome as possible, so you will know the final price, and you don't need to worry if you can afford to have many eggs, many embryos, because this is something that you want to have it. And especially once we get into the freezing of the embryos, that we don't want to put you in the position when you have to decide on your own if you wish to freeze 1 or 2 embryos or a straw at the expenses of their survival rate, because once you decide to thaw 1 embryo, so you will not put all the embryos at the risks. So there are still some things that you would need to think about. But with our IVF packages in CUBE in Prague, everything is covered and you don't need to worry about that. Firstly, if I will show you one of our packages, which is IVF-XC therapy with the donated eggs, the total cost of this therapy is 6,300 euros, and it includes absolutely everything from the beginning till the end, so everything you will need. So once we start with the online consultation with our egg donation specialist, but then also the preparation of the therapy plan for you and for the donor, but also all the donors' expenses, medication, examinations, also then the evaluation of all your scans, examinations, but also for the donor. Additional, if you come to our clinic for these scans during the therapy, also 2 scans are covered if needed. Then the egg donation, egg collection of the donor under the general anesthesia, then sperm collection. With the egg donation therapy, we also offer the cryopreservation of the sperm sample in advance, and it's storage for 1 year, so it gives you some flexibility while planning the whole process. Then MFSS, one of the sperm selecting method that help us to choose the best sperms for the IVF. Then 𝐾𝐶 method, used for the fertilization of all retrieved and mature eggs that you will get from the donor. Then assisted hatching and cultivation of all your embryos into the blastocyst stage. 1 embryo transfer, it can be fresh or frozen, depends on the situation. We always want to aim for the fresh cycles, but you never know what can happen. So even the frozen transfer can be included. And then also the cryopreservation of all remaining embryos you may have, and the also storage for 1 year for the first year of the therapy. With the egg donation therapy, we also offer the guarantees of minimum 8 eggs from the donor and a minimum of 2 suitable embryos for the transfer if the sperm sample is classified as normal zoospermia. So that's our, I would say, the biggest and the fullest package we have. And if we will move to therapies with own eggs, we can see that also it includes absolutely everything. There is almost no difference except of the donor, of course. So we also start with an online consultation with our doctor, then the preparation of the therapy plan for you, the evaluation of all the scans and examination during the therapy. If you will come to our clinic, 2 scans you will have included as well. Then the egg collection under the general anesthesia, sperm collection, MFSS as a microfluid sperm separation, the sperm selecting method, 𝐾𝐨𝐧'𝐭 method used for the fertilization, again, of all retrieved and mature eggs, assisted hatching and cultivation of all embryos into the blastocyst stage, 1 embryo transfer, and also the cryopreservation of all remaining embryos at their storage for the first year. Here you see that we do not include the cryopreservation of the sperms, as we assume that partners will come and travel together at the day of the egg and sperm collection, and otherwise everything is the same. And also we do offer the PGT, pre-implantation genetic testing of embryos, and the total cost of this testing is 3,300 euros, but it's regardless the amount of the embryos you will have. So you don't need to worry if you have number of embryos, it will be always 3,300 euros. Also the price for the IVF CUBE with own eggs, it's 3,300 euros. Here, if we have just in the general, like the comparison of all our main packages, you can see there is between the donated eggs and own eggs, the only difference is the egg donation and cryopreservation of the sperms. Sometimes it may seem that we are more expensive than other clinics, but once you get into the final costs, you may end up with, if you decide, let's say, like, for example, cheaper clinic or better package, then in the end you can end up with higher bill anyway, because there will be hidden costs. Right now you see that our therapies, our packages includes all necessary parts that you need, and also very importantly, regardless the number of eggs and embryos in all cases. So, and if right now, I'm not sure if all of you are familiar with all the terms I used, if I listed was everything included in our packages. Now just briefly go through some terms. So if we're talking about the 𝐾𝐨𝐬, which is the IVF method, when we will take 1 sperm and directly inject it into the egg, which can dramatically increase the success rate. MFSS, I would say we are one of the clinics that are including that in the standard of our treatments. Microfluid sperm separation, which is the method when help us to choose the best sperms for the fertilization by the 𝐾𝐨𝐬 method as mentioned. And during this method, we mimic the environment of the uterus, of the female uterus, and we will see which sperms are getting on the end as the best ones, as the first ones, and these will be used for the fertilization. So that's also included in all our therapies. As mentioned, the assisted hatching. Assisted hatching is like a special method when we use the laser, or our embryologists use the laser to perform like a small hole into the eggshell, and that helps the embryo to get, let's get out and more expand, and then it's easier for the embryo to get through the membrane, and also it increases the chances for the implantation of the embryo into the uterus. Prolongated cultivation, that means that we also want and aim for the embryo transfer on day 5 when we have the blastocyst stage. So we try to also cultivate, if possible, the embryos into the blastocyst stage, and then transfer them on day 5. Yes, and very importantly, single vitrification of embryos, which is the cryopreservation of embryos. We do offer, and it's only methods we use as the vitrification. It's like the gentle method for the embryos, sperms, or eggs of the rapid freezing. So it's very careful. We are careful from them. It's good for them. And the single vitrification means that we freeze all embryos separately, which means one embryo in one straw, and that's mainly due to the safety of once we are thawing the embryos for example, for the transfer. You are not putting other embryos at the risk, but we always thaw only one embryo, that one particular embryo that we want, and all remaining embryos are safe in the storage and are staying in the freezer. And then, as mentioned, the first year of the storage for the embryos, sperms, or the eggs are included in the price, and after the year you can extend the storage if needed, but that's up to you. So all of these are included. All of them are just the standard of our work. And as mentioned, in regards to the payment itself, we do not want any deposit. There are no prepayments, and the whole therapy just needs to be paid by the day of your fresh embryo transfer. As mentioned, there are no hidden costs. We also have to mention what is not included in these packages, in these total therapies. One of the, let's say, items is a viral screen, because due to the Czech legislation, once you're leaving the biological material at the clinic, we have to do the viral screen for each patient. Viral screen, it's €100 per person, and the main reason why it's not included in the total cost of the in the package is that the viral screen is valid. The results of the viral screen are valid for several months, even years. So once you're repeating some therapies, you don't need to undergo the viral screen again, as you did it in the past at our clinic. Also, we do not include the medication for the patient. As mentioned, with egg donation therapy, the medication for donor is already included, but not for the patient. And the main reason is that due to the different locations, different protocols, and different medication itself, and also the dosages, the medication costs can vary. If you will buy it in the Czech Republic, if you will buy it at our clinic, if you will buy it locally in your place, the price can be different. So we don't want to give you the costs of the medication in advance, as it can be quite individual. As mentioned, all of the methods that were seen are included, are standard and standard of our work and treatment. But of course, you may ask for some additional methods, so they are not included in the total costs. But we do offer some genetic additional methods, sperm selecting methods, immunology testing and examinations, further investigations, and also some, let's say, like add-ons, some extras that can only increase the chances for your success of the therapy. But if any of these additional methods are recommended for your case, it's always medically relevant and usually recommended from our doctor to your particular case during the consultation. So I hope that I covered all my bits, and right now, if you have any questions, I see that already some questions are getting into the chat. I'm still happy to answer if you have something else, so please just write it down. And also in the future, if you will have any further questions or inquiries to our clinic, and we are always happy to answer it on our email address. Here you can see my email address and also our general coordinator email address. So thank you, and now we can just look for the questions we have. Here I can see. Yes. Do you have any guarantee packages for IVF with own eggs? And what are the requirements? Unfortunately, we don't have any guarantee packages because with own eggs therapies, because it always depends on your anamnesis, on patient anamnesis, on the previous records, on the blood test results, on the ultrasound scan results. So with that, we cannot guarantee any outcome. We always want to do the best, and we are trying everything with the best intention for the best outcome for our patient. However, we don't have any guarantee program here. Here I see. Also, one of the questions is, what about the embryos or the sperms after the 1 year after the first year? As mentioned, you can extend the storage of all your embryos, sperms, or eggs, and every additional year, it's 200 euros, regardless the number of eggs, sperms, or the embryos. Okay, here we have something else. Yes, so we have the question if can excess embryos, if DNA tested okay, or the excess sperms be donated or even sold to another patient, same or to the different clinic. Unfortunately, we cannot, let's say, after, if you don't wish to extend the storage of your embryos, of the eggs, of the sperms, there are some options how you can end it up with the storage. One of them is to terminate the storage, but otherwise you can also give your cells for some research if there is any research opened, but you cannot provide or even sell your embryos or the cell or the sperms to another patient or to another clinic. Another question is if we plan to introduce any guarantee program packages in the future. Actually, this is something I don't have any information about that yet. Maybe something is preparing, but as mentioned, as everything depends on the particular results, we won't always do individual approach for the patients. So we always want to prepare the best plan according to particular needs. And I'm worried that guarantee program here will not be something, I would say, that suit to all of the patients, the most of the patients. Okay. I see that some clinics make guarantee packages with UK insurance. Here in Prague, at our clinic, we don't work with any abroad health insurance companies. So in that case, I'm worried that it will not work here as well. Okay, so another question is, when, as mentioned, the treatment has to be paid by the day of the fresh embryo transfer, when the PGT needs to be paid. With the PGT testing, at the day of your last egg collection, and you decide to have the PGT testing, the PGT just needs to be paid by the day of your last egg collection, egg retrieval. And then after about 4 weeks, we have results. And then if there is suitable embryo, we can plan a fresh embryo transfer. So just wondering if there is something else that you would be interested. I assume that I covered all the bits and there are no more questions. Yes, I see. Yes, there is another question about the egg donation therapy, and if you can tell more about the availability of the egg donors. Yes, here in the Czech Republic, we have anonymous program, and most of our donors are from the Czech Republic. However, we have quite broad, let's say, range of the phenotypes. At the moment, we have about 700 active donors, and we can offer different phenotypes from the blonde hair, blue-eyed, till the, let's say, olive skin, black hair, green eyes, brown eyes. So I believe that we have quite good pool of our donors. No, we don't cooperate with any egg banks. We have our own database, and we always want to do the fresh cycles. We always aim for the fresh stimulation and the fresh embryo transfer, if possible. So we have our own database, and we don't cooperate with any egg banks with the frozen oocytes. What would be the cost to do the half donor sperm and rest freezing eggs? For the sperm donation, actually this wasn't mentioned. For the sperm donation, the additional cost is 600 euros. And then if there are any special treatments, like doing half and half, let's say stimulation with male partner sperms or the sperm donation, both therapies needs to be covered. So it will be 3,300 euros for the stimulation with own eggs and own sperms, plus there will be 600 euros for the donor sperms. But if you have some like a special inquiry, special request, I will be happy to answer it on the email with maybe more detailed information about the total cost for your particle therapy. Okay, I here see another questions in regards to the sperm donation. At our clinic in the Czech Republic, unfortunately, I'm obligated to inform you we can treat only couples, only male and female partner. We cannot treat only single woman, according to the Czech legislation. Yes, we also offer embryo donation. Embryo donation, it's a total cost of the package. It's 2,100 euros, and we offer one embryo at a time. Yes, as I mentioned, that the embryo storage is included. There is no limit of number of frozen and stored embryos. There is always, it's included for the first year, and then always 200 euros for additional year, regardless the number of embryos you have. Good question about the following transfers. Only one on the first embryo transfer, it's included. All remaining frozen embryo transfers, if you have any frozen embryos at our clinic, the frozen embryo transfer, it's 1,250 euros plus the medication as well. Yes, if you would like to use a donor sperms, you need to be still a couple with a medical indication for using the sperm donors. Embryo transfers, how long does it take? It's quite like easy gynecology examination. So about like 15-30 minutes for the embryo transfer here at the clinic. If there is a question, if there is a rule couple in all Prague clinics, yes, that's done due to the Czech legislation. We can treat only couples. They don't need to be married, but they need to be male and female couple. There is a question if we recommend flying to Prague for the transfer day and back on the same day, or resting before or after in a hotel. I would say this is quite individual according to your feelings, and just I would say everything should be comfortable for you. If you will fly to Prague in the morning, you can have an embryo transfer in the afternoon, and if you feel like you can fly back home in the evening. There are no restrictions, recommendations about the traveling or flying. More likely about you and your comfort, what will suit you better. If maybe you will have a just day off here in a hotel, have some good food, and make it like a holiday or a special vacation for the special souvenir from Prague. As embryos, so it's up to you. There are no restrictions from our side, and the best recommendation is how you feel. Thank you too. Okay, so I'm wondering if there are more questions in regards to the pricing. Hopefully it was well explained and at least a bit clarified. And otherwise, if no more questions in regards to the pricing or any therapies at our clinic. Yes, and we have one more question about egg freezing. Egg freezing is a therapy that can be done for a single woman, and total cost of the egg freezing therapy is 2,300 euros plus the medication. Okay, everyone, so I would like to thank you for your time, and have a nice rest of your evening, and we are always happy to answer any more questions or inquiries on our email, so please feel free to contact us anytime. Thank you. Have a good evening. Bye-bye.